One run a medical translation service in Munich. And last month, an American tech consultant walked into my office demanding I help him sue a pharmacy. His crime? The pharmacist refused to accept his CVS prescription from Boston. He kept insisting this violated international law because America sets the medical standard. I asked which treaty guaranteed American prescriptions worldwide validity. He said the Geneva Convention. That's for war crimes. The man genuinely believed his Massachusetts doctor had prescribing authority in Bavaria because doctors are doctors. I explained German physicians require German licenses to practice German medicine. He responded that this was discrimination against American healthcare superiority. When I mentioned he'd need to visit a German clinic for a new prescription, he asked if they accepted his Blue Cross card from Connecticut. I said no. He asked about his HSA account. Also no. Then he wanted to know if German doctors could access his Epic medical records from Massachusetts General. Sir, they barely have fax machines. He left convinced the European Union was violating WHO regulations, which he claimed required all countries to honor American medical documents. I checked later. No such regulation exists. At the same pharmacy, an American exchange student tried returning unopened antibiotics for a refund. The pharmacist explained, German law prohibits returning prescription medications once dispensed. The student insisted this was illegal under consumer protection laws because you can return anything within 30 days in America, and told German pharmacies aren't Costco. She demanded to speak to the regional manager. There isn't one. German pharmacies are independently owned. She threatened to report them to the Better Business Bureau. That's an American organization with zero authority in Europe. My neighbor works reception at a Hamburg clinic, and an American tourist arrived without an appointment expecting immediate service. When told he needed to book ahead, he announced, I'm a premium member, and showed his American insurance card. Premium of what? German clinics don't have membership tiers. They have appointments. He insisted American insurance entitled him to priority access because he pays thousands monthly. The receptionist explained German clinics operate on scheduled bookings, not payment status. He asked when the walk-in hours were. Monday through Friday, 8 to 10 a.m., for urgent cases only. He said his knee pain from jogging qualified as urgent. It had hurt for 3 weeks. That's not urgent. That's chronic. He left muttering about socialized medicine, causing inefficiency. My sister's boyfriend manages a Berlin orthopedic practice, and an American businessman demanded a same-day MRI appointment. When told the earliest slot was 3 weeks out, he offered to pay double. The scheduler explained, payment doesn't change availability because insurance pays standard rates regardless. He raised his offer to triple. She repeated that German healthcare doesn't operate on bidding systems. He accused her of refusing his money due to anti-American bias. She pointed out she just explained the system applies to everyone equally. He insisted this proved the system was broken because in America, you can always pay for faster service. Yes, that's called a two-tier system. Germany deliberately designed theirs to prevent exactly that. He demanded her supervisor's contact information to complain about discrimination. The supervisor called him back, explained the identical policy, and offered him the same 3-week appointment. He hung up. I work for a Cologne hospital. And an American patient refused to provide his insurance card because privacy laws prohibit sharing medical information. Explained the card contains no medical information, just insurance details needed for billing. He claimed HIPAA protected him from sharing insurance data. HIPAA is American legislation with zero applicability in Germany, and it specifically allows sharing insurance information for treatment purposes. He insisted I was violating federal law by requesting it. Which federal law? The German one requiring insurance documentation for medical care. He meant the American one. We're in Germany. Those don't apply here. He threatened legal action for HIPAA violations against a German hospital in Germany for following German law. His lawyer's consultation fee probably exceeded his entire German hospital bill. My cousin schedules specialist appointments in Dusseldorf, and an American relocated executive called demanding an endocrinologist appointment within the week. When she offered availability in 5 weeks, he said that was unacceptable because I have a thyroid condition. She asked if it was an emergency requiring immediate care. He said no, just his quarterly monitoring appointment. That's routine care, not urgent. He insisted quarterly meant it couldn't wait 5 weeks because it's supposed to be every 3 months. Sir, you're 2 weeks past your 3-month mark already. 5 more weeks won't change your clinical outcome for a routine monitoring visit. He claimed American medical standards required quarterly appointments exactly 90 days apart. She asked which medical board published those standards. He said all of them and accused her of malpractice for suggesting schedule flexibility. Malpractice for appointment scheduling. She booked him at 5 weeks. He showed up 4 weeks late and complained about the long wait. My brother's wife runs a pharmacy in Stuttgart, and an American graduate student demanded immediate filling of his ADHD prescription from Ohio, she explained. German regulations require German prescriptions for controlled substances. He insisted American prescriptions were legally equivalent under NAFTA. That's the North American Free Trade Agreement. We're in Europe. Even if we weren't, NAFTA covers trade goods, not medical prescriptions, and it doesn't include Germany. He argued that international medical reciprocity guaranteed his American prescription's validity. She asked which treaty established this reciprocity. He said the standard one that all developed countries signed. No such treaty exists. She offered to help him schedule a local psychiatrist appointment for a German prescription. He refused because his American doctor knows his case history. She explained he could bring his medical records to the German appointment. He said that would take weeks to request. Then he asked how long a German prescription would take. 1 appointment. Usually within 2 weeks. He insisted this was unreasonable compared to his American system, where he just called in refills. Yes, for a medication prescribed by a doctor licensed in his jurisdiction. That's how medical licensing works everywhere. My wife works emergency intake at a Frankfurt hospital. An American arrived with a twisted ankle from a soccer match. After examining him and confirming no fracture, the doctor recommended ice, elevation, and ibuprofen. The American demanded an MRI to rule everything out. The doctor explained clinical examination showed no indication for imaging and insurance wouldn't cover unnecessary procedures. He insisted he wanted it anyway and would pay out of pocket. The doctor still declined because medical ethics prohibit performing unindicated procedures regardless of payment willingness. He accused her of withholding care to save money. No, she was following evidence-based medicine guidelines that discourage unnecessary imaging for clearly diagnosed minor sprains. He insisted American doctors would have ordered the MRI immediately. American doctors also face higher malpractice litigation rates in defensive medicine practices that incentivize over-testing. The German system prioritizes clinical necessity over patient demands. He left insisting German medicine was decades behind because they wouldn't waste healthcare resources on his sprained ankle. I handle billing at a Leipzig clinic, and an American patient was shocked his emergency room visit cost 65 euros. He kept asking where the real bill was. That is the real bill. He insisted emergency rooms cost thousands in America. Yes, in America. This is Germany. He demanded an itemized breakdown proving they actually did anything for 65 euros. I showed him the chart noting examination, vital signs, consultation, and diagnostic assessment. He said that would cost minimum $1,200 in Boston. Probably accurate, but we're not in Boston. He accused us of fraud for undercharging because nobody provides quality healthcare that cheaply. Sir, this is how our system functions. He left convinced we had accidentally given him the German citizen discount and he'd receive a corrected invoice within 30 days. We didn't, he won't. That was genuinely the cost. My daughter schedules appointments for a dermatology practice in Nuremberg. And an American patient called requesting a full-body skin cancer screening for the following day. When told the earliest availability was 6 weeks, she offered to pay cash instead of using insurance. The scheduler explained payment method doesn't affect appointment availability. She insisted paying cash should guarantee faster service because that's how private practices work. German private practices still operate on appointment schedules, not auction systems. She argued that American dermatologists always accommodate cash-paying patients immediately. The scheduler asked if she had evidence of any medical emergency requiring urgent dermatologic care. The patient said no. She just wanted her annual screening. So routine, preventive care, not an emergency. Exactly the type of appointment appropriately scheduled 6 weeks out. She claimed American medical standards required annual screenings with no delays. The scheduler suggested booking the 6-week appointment to ensure she received care within her annual window. She hung up muttering about socialized medicine rationing. My uncle's neighbor works reception at a Hamburg general practice, and an American patient arrived 20 minutes late for a 30-minute appointment slot. When informed they'd need to reschedule because the doctor was now with the next patient. He protested that I'm only 20 minutes late for a 30-minute appointment. That leaves 10 minutes, and the doctor needs time to review your chart and conduct a proper examination. He insisted German efficiency was a myth if they couldn't accommodate a 20-minute delay. Sir, efficiency means we started the next appointment on time rather than making them wait for you. He demanded they interrupt the current patient so he could have his appointment. The receptionist declined to interrupt another patient's medical care for his scheduling failure. He claimed American doctors always accommodate late patients. American doctors also frequently run an hour behind schedule because of exactly that accommodation, which is why you typically wait 45 minutes past your appointment time in American waiting rooms. He left, insisting the German system's refusal to reward his tardiness proved it was inflexible and patient hostile. My coworker's husband runs a radiology practice in Bremen, and an American patient demanded her mammogram results immediately after the procedure. The technician explained the radiologist reviews images and sends findings to her referring physician within 3 business days. She insisted on seeing them right away because it's my body. The images require specialist interpretation. Raw images without proper analysis could cause unnecessary anxiety or false reassurance. She claimed American law required immediate result disclosure. German medical practice standards require qualified physician interpretation before result communication to ensure accurate information. She threatened to sue for withholding her own medical information. The images were being processed for proper evaluation, not withheld. She'd receive professionally interpreted results through her physician within 72 hours. She demanded to speak to someone in charge who understood patient rights. The radiologist himself explained the identical policy. She left, insisting German medicine violated informed consent principles by refusing patients immediate access to uninterpreted diagnostic images. The radiologist noted her results were normal, which her physician communicated 2 days later, exactly as promised. I process insurance claims for a Bonn medical clinic, and an American patient was outraged. His prescription medication copay was €7. He kept insisting there must be additional charges coming. That's the complete cost. He asked about deductibles. The German statutory insurance system has minimal copays, no deductibles. He said that was impossible because insurance always has deductibles. American insurance typically does. German public insurance generally doesn't. He accused us of fraud for not properly billing him because medication costs hundreds per month, not in Germany with statutory insurance. He demanded written confirmation that €7 was genuinely the full cost. I provided a receipt stating exactly that. He spent 15 minutes convinced this was some kind of promotional pricing that would end next month. It won't. This is standard German pharmaceutical pricing with public insurance. He left muttering that the system must be hiding costs somewhere because nothing medical could actually cost that little net. My nephew's girlfriend works administrative support at a Hanover surgical center, and an American patient, scheduled for a minor outpatient procedure, asked about the surgical facility tours. What tour? He wanted to see the operating rooms beforehand to evaluate cleanliness standards. The facility doesn't offer tours to patients. Sterile surgical suites aren't tourist attractions. He insisted American surgery centers always provide facility tours so patients can verify sanitation protocols. The administrator explained German facilities comply with rigorous health ministry standards subject to regular inspection. He demanded documentation of their most recent inspection results. That information is available through the health authority, not provided on demand to individual patients. He threatened to cancel surgery over their refusal to demonstrate cleanliness. The administrator noted he was welcome to cancel, but they'd been operating for 30 years with exemplary safety records and didn't need to justify their protocols to satisfy his American expectations. He proceeded with the surgery. It went fine. He later admitted the facility was surprisingly clean given their unwillingness to prove it in advance. My former roommate manages medical records at a Freiburg hospital, and an American patient demanded his entire medical file transferred to his hotel for review. The records department explained files remain at the facility for security and privacy, but he could review them on-site or request specific documents. He insisted German law required releasing full records immediately upon patient request. German data protection law actually requires keeping medical records secure, not distributing complete files to hotel rooms. He could review everything at the hospital with staff support. He claimed this violated American medical transparency standards. We're not in America. German privacy regulations prioritize secure record management. He threatened to report them to an American oversight agency for obstruction. An American agency has no jurisdiction over German medical records management. He could file complaints with German data protection authorities if he believed his rights were violated. He never did. The records remain secure at the hospital. My colleague at a Munich pharmacy watched an American patient storm out after refusing to provide identification for a prescription pickup. She kept shouting about HIPAA violations for requesting ID. German pharmacy regulations require identification verification to prevent medication dispensing errors. That's patient safety protocol, not privacy violation. She insisted American pharmacies never check ID. They do for controlled substances, and often for all prescriptions depending on state law. She threatened to report them to authorities for illegal identification demands. The authorities wrote those exact regulations. She left without her medication. The pattern is identical. Americans arrive expecting German healthcare to function as an extension of their domestic system, then interpret standard German medical protocols as inefficiency, discrimination, or fraud. Last week, an American patient complained that German hospitals don't validate parking. They're treating your medical condition efficiently and affordably. Maybe handle your own parking fee.